Welcome back to another episode of HealthCap Weekly Wrap, and Happy New Year. As we step into 2026, we're kicking things off with a look at some important developments in senior care. From CMS updates and care quality research to staffing transparency and new clinical guidance. We've got a lot to cover that can help you start the year informed and prepared. Let's jump in.
So, starting off with something that's going to impact a lot of our listeners, ownership transparency. According to a recent article from McKnight's, CMS is putting more emphasis on collecting detailed ownership data from nursing homes. And this isn't just a paper exercise. They're signaling that increased enforcement efforts and audits will likely follow.
Right, and this goes back to that executive order from 2022 that called for more transparency in corporate ownership of healthcare communities. CMS has already started requiring communities to disclose ownership structures and management companies. But now they're saying, okay, we've got the data, now we're going to use it.
Exactly, and for those of us working in senior care, that means we need to make sure that our documentation is buttoned up. If there are layers of ownership or third-party management groups involved, CMS wants that spelled out. This could impact survey outcomes, especially if audits are part of the enforcement process.
And ultimately, it's about accountability. If residents and families know more about who's running a community, it creates more trust, or at least more transparency. It's a good reminder that reputation and regulatory compliance are more connected than ever.
Definitely. All right, moving on to the CMS Dear Doctor letter. This was recently posted on the CMS website. It's their annual message to Medicare providers, outlining policy priorities for 2026. Now, while the letter is addressed to physicians, it's actually packed with relevant points for those of us in senior care.
Yeah, they really hit on some big themes. Reducing administrative burden, strengthening program integrity, and advancing whole-person care. And something I found interesting, they're putting a lot of focus on how technology can support integrated care models.
That's a big one. With more residents dealing with multiple chronic conditions, whole-person care isn't just a buzzword, it's necessary. And from a senior care standpoint, aligning with these goals means we're going to see more push for collaboration across providers, especially with home health, therapy, and pharmacy partners.
Right. Also, keep an eye on value-based payment models. CMS is clearly trying to shift away from volume-based care. That affects how we work with physicians, therapists, even labs, and it's worth reading this letter in full. It's available as a PDF on the CMS website. Just search for Dear Doctor Letter 2025, and it should come right up.
Let's shift now to another story from McKnight's. This one is about agency staffing. A group of researchers is recommending that agency nurse staffing data be made publicly available, just like regular staffing levels already are.
And the reason is pretty straightforward. There's growing concern that heavy reliance on agency nurses can lead to care inconsistencies. Residents benefit from stable teams. And when staff are constantly rotating, even if they're qualified, it affects continuity and resident relationships.
Exactly. The study notes that high agency usage is often linked to higher staff turnover, which in turn can impact care quality. And from a transparency standpoint, families want to know who's actually providing care.
It's worth noting this article came out earlier this year, but it remains highly relevant, especially as CMS continues pushing new staffing proposals. If public reporting becomes a reality, communities will need to be ready to explain how and why agency staff are used.
And it might even push communities to invest more in recruitment and retention, just to reduce the need for agency use in the first place.
Right? It's not about criticizing agency nurses. It's about ensuring consistency and trust in the care environment.
Now let's talk about a compelling study, also from McKnight's, that looked at hospital visits among the most medically complex residents in nursing homes.
Yes, and what's striking is that these are the residents with the most advanced conditions. Things like late-stage dementia or multiple chronic illnesses. And yet, a large number of hospitalizations in this group may actually be preventable.
The researchers emphasize the role of advanced care planning. If communities are having those conversations early and documenting goals of care, it can reduce unnecessary hospital transfers that may not improve outcomes.
They also pointed to gaps in on-site clinical resources. In many cases, hospital transfer isn't the best option. It's the only option available due to a lack of access to physicians or nurse practitioners.
This connects directly with CMS's messaging around whole person care. If we can improve coordination and availability of clinical support, especially after hours, we can help residents stay in place when appropriate.
For teams in senior care, this is a good reminder to review protocols, make sure your advanced care planning is up to date, and train staff to identify when a transfer is truly necessary.
All right, let's move on to something a little more technical but still important. A few months ago, CMS clarified the qualifications required for speech-language pathologists providing outpatient services under Medicare Part B.
Right. The update states that only individuals who meet both the educational and state licensure requirements can provide and bill for these services. And this includes telehealth as well.
This clarification helps ensure residents are receiving therapy from qualified professionals, and it protects communities from potential billing issues or compliance problems.
Especially in smaller or rural communities where staffing flexibility is often needed, this is a good reminder to double-check that any SLPs being used are properly credentialed. CMS has made it clear there's no wiggle room here.
Let's wrap up with a clinical update that could impact a large number of residents. Earlier this year, McKnight's covered the first major update to chronic kidney disease treatment guidelines since 2012.
That's right. The group known as KDIGO, which stands for Kidney Disease Improving Global Outcomes, released updated guidance that puts more focus on early detection and intervention.
This matters for senior care because many residents live with kidney disease, and a lot of it goes undiagnosed or undermanaged. These new guidelines recommend earlier screening, personalized treatment, and broader use of medications like SGLT2 inhibitors to slow progression.
Even though this update was released a few months ago, it's still gaining traction. Now's a great time for providers and interdisciplinary teams to review how they manage residents with CKD and consider what adjustments might be needed.
And this is another area where coordination with pharmacy partners can make a big difference, especially when it comes to evaluating meds and preventing interactions.
And with that, that's a wrap for this week's HealthCap Weekly Wrap.
If you want more details on any of the stories we talked about today, you can find them in the weekly roundup on Angie's blog at healthcapusa.com/Angie's-blog.
Thanks for listening. We'll be back next week.